So I thought I'd talk a little bit about dealing with unhappy patients and how to optimize the chances of reaching a happy ending with patients. And this applies to medicine, what we do, but it can also apply to dealing with people or dealing with customers or just dealing with human beings in general. And what spawned this is I received an email from Anton Bietka from Randhart, Alberton, South Africa. And he wrote, "Personally, I find dissatisfied patients are a real challenge to deal with from an emotional point of view, even if objectively my work is excellent. You often say at the end of your videos that most importantly, the patient was happy. That really is paramount. But regardless, you win some and lose some. The key is you do your best." And so I thought to myself, some patients are just not happy with their outcomes. And how do we prevent this situation, and how do we manage it when it happens? I've learned a lot from my own mistakes over my own lifetime and my own career. And so I thought I'd share some lessons learned along the way so you can learn from my mistakes. So you get out of school and you go into practice. You're young, bright, and talented, and you're capable, and you've got all the credentials now, and you're a pro. You're autonomous. You're basically the man. And when I was coming out of training, I was 29 years old. I would say if you're a physician coming out into the world and beginning practice, you're going to be between 29 and 40 in most instances in the U.S. And you have some life experience, and that's super important. But looking back now, I realize I didn't know so much when I started out, when I thought I knew it all. And looking back, I've learned from my mentors on habits and characteristics and communication styles to emulate. And probably equally important, I've learned from mentors habits and characteristics and communication styles to avoid at all costs, because it only creates problems. And importantly, you learn from your patients every day by communicating and interacting with them. You learn through those interactions what is more effective and what's less effective. So what are some principles that I've learned in how to deal with unhappy patients? Number one, so always level with the patient. Treat them as if they're smarter than you and they're knowledgeable. Treat them with respect. Don't ever try to manipulate them or base your recommendations on money. I've seen it where doctors will convince patients to pursue a course of action, and they do it because it will help the patient. But I think there is a huge component where the doctor is just thinking, if the patient makes XYZ decision, then the doctor or the practice will profit more. And I don't think that is a good practice basically ever. It should always be, your recommendation should always be a win-win. It should be a win for the patient and a win for the practice and everybody involved. But the priority should be what's best for the patient. Give the patient a choice, educate them, inform them of all their choices, and then accept that they may make no decision. They may go with a decision that I believe is the best, or they may go with a different decision. But give them the choices and accept whatever choice they make. Just explain to them the consequences of that choice. If they buy into that consequence, that outcome, and that's their decision, however they arrive at it, then it's probably the right decision for the patient. And if the patient ultimately is happy, then that makes everybody happy in the end. To sum up, treat the patient, the customer, with humility and with respect. How do we avoid creating an unhappy patient? Set realistic expectations. Under promise and over deliver. Do not oversell anything. Do not promise or guarantee a certain outcome to incentivize the patient to move forward with the decision that you want them to have. Level with them. Give them realistic expectations. Or as I say, show them all your cards. Lay all your cards out on the table and say, hey, these are your options. This is what will happen if you choose option 1. This is the outcome with option 2, and this is the outcome with option 3. And whichever option you feel is in your best interest as the patient or the customer, we're going to help you achieve that outcome. In order to avoid creating difficult situations with patients, it is most important, in my opinion, to develop what I call pattern recognition. Difficult personalities will reveal themselves. There's a certain pattern to their behavior. There's a pattern to their nonverbal and verbal communication styles. And it just takes life experience to identify these people. But once you identify them, imprint that template of personality into your brain so you can recognize it early on the next time an individual with a similar personality comes to you as a patient. And let's say you have somebody who wants a guarantee and who's a perfectionist. Identify that individual and identify it early, and then explain to them, hey, Mrs. Jones, we cannot guarantee you perfection. Perfection doesn't exist. If you are going to move forward with this procedure, you have to accept certain risks, certain side effects. There will be benefits, and let's explain the benefits, but almost overemphasize the side effects and risks such that if that person has a super high expectation, you actually lower their expectation to a level that you know you can deliver upon. So if perfect is here and you know that they expect this, they're actually starting here. The technology and the procedure we offer can bring them to this level. This is perfect. This is where they are. And they expect this. You need to make sure that you tell them. You'll have, for example, with our business, you'll see a halo around lights at night. You might need glasses some of the time. The vision may not be as perfect as it is when you're 20 years old, but you'll see well in most situations without glasses. And if they can accept those side effects, then that makes them a more acceptable candidate for moving forward with a procedure or surgical procedure. If they can't accept those side effects, it's probably best to just say, hey, Mrs. Jones, we probably don't have the best technology or the best procedure to help you see the way you want to see currently. And if they walk away and come back another day, that's a total win, because you don't want to under-deliver on somebody who has a very high expectation when you know that the likelihood of their being disappointed or dissatisfied is unacceptably high. A fourth situation that can be tricky is you have a very demanding patient with a complex problem and they really need surgery. So for example, we operate on patients with one eye. So they would have a blind eye or no eye here. This eye would have a cataract that's complex, it's hypermature. How do we deal with those patients? Well, we tell them, Mrs. Jones, you have a complex situation. We're going to do our very best. I can't guarantee your outcome, but ultimately, over your lifetime, you will have needed to have prepared for that situation. There are two situations that unfolded during my medical education that I remember. Number one, when I was on my obstetrics and gynecology rotation, the OB-GYN, his name was Terry Simon. This was at Baylor College of Medicine. He said, treat your patient as if you're treating your spouse or your family member. And I think if you apply that high standard to each situation, then it always helps you make wise decisions. You're not going to recommend something dangerous or unsafe or that is not in everybody's best interest to your wife or your spouse or your beloved family members. And there was a second situation I remember where I was in Wilmington, Delaware with an ophthalmologist named David Larned, and he's an oculoplastic surgeon. And I believe we were trying to repair an eyelid laceration where the lacrimal canaliculus, the tear drainage system, had been damaged. And we were trying to insert a tube through the lacrimal system. And I tried once and I couldn't do it. And he said, "Doc, I'm going to give you one more chance and then I'm going to take over." And I had to get it right with that one shot that I had. Otherwise, he would take over. And I think that would be kind of embarrassing. And it would make me look bad to my professor, my attending physician. And fortunately, I was able to pull everything together and perform under pressure. And that was memorable. That built confidence. And I think over your lifetime and over your career, you have to push yourself to learn new skills, acquire new tricks and techniques, and practice doing simple things perfectly every time, such that when you encounter difficult situations, you have that self-confidence from executing simple tasks perfectly that it makes executing complex tasks more achievable. And as you try more and more complex tasks, you'll learn tricks and maneuvers on how to accomplish these complex maneuvers during surgery. In fact, you'll learn in dealing with complex personalities how to deal with them before surgery. But it takes that constant desire and interest and the will to want to learn new tricks in communication, new tricks in the operating room, surgical skills, such that when you deal with the most complex problems, you have a foundation that you're constantly building upon over your lifetime, such that when you're older, I believe you should actually be better than the younger surgeon. So I believe that I'm 53. I believe a 53-year-old surgeon should be much better than a 33 or 43-year-old surgeon. And if I carry that to its natural extension, as a 63-year-old surgeon, I should be even better than a 53-year-old surgeon. So it's that constant daily grind, putting in the effort to get better, that helps you deal with the complex patient and the complex scenarios, such that if you have to operate on somebody who has one eye and their other eye's blind, and the eye that you're working on is scarred and damaged and has coexisting situations that make surgery difficult, you can come through and deliver for that patient. So if you're a younger surgeon, you will encounter these situations, and put yourself mentally into these situations, even when you're dealing with surgeries that are easier. Practice role-playing the most difficult situation when you're dealing with more simple situations. So when the difficult situations arise, you're ready mentally, and you've developed the skill set to handle that situation. Here's another situation. The surgery goes well. Everything looks good, but the patient is not happy. This happens quite frequently, unfortunately. The patient sees on the eye chart perfectly. They're 20/20 far, they're 20/20 near. They don't really need glasses. They can function, but they don't like how they see. How do we deal with that? I think one of the most important things is don't dismiss that patient's concerns or dissatisfaction with the outcome. The last thing they want to hear is, you see perfect. I don't understand why you're unhappy because you see perfect. You have to detach from your ego. You have to subordinate your ego to understand that that patient objectively sees quite well, but subjectively their issues are there and they're legitimate. So you have to give validity to that patient, understand things from their point of view, and then try and find out what can be done. So for example, there are patients that I've operated on, they see great, 20/20, no refraction, no astigmatism, everything looks great, their cornea is perfect, their lens is perfectly centered, the posterior capsule is clear, the OCT of their macula and optic nerve is perfect, everything looks great, but they say, "Doc, I can't stand the way I see." I've learned, and I continue to learn, that there are causes for their dissatisfaction that we just have to open our mind to. There was a situation where a patient came in and she had a PanOptix lens, and I was going to take it out and replace it with a monofocal lens. She coincidentally underwent a vitrectomy to remove her floaters that she was bothered with before we did her lens exchange to remove her PanOptix. And she came back in and said, I see great. I love my vision. It was the floaters and I never realized it. Importantly, what I discovered is I never realized that her floaters could be that symptomatic and bother her that much, despite her seeing normal in every way. So at age 53, after putting in 5,000 multifocal IOLs, it took me 5,000 to learn that vitreous floaters can cause significant visual dissatisfaction. I had never referred a patient to get a vitrectomy for their visual dissatisfaction with a multifocal or presbyopia correcting IOL. Since that time, I realize now that some of the patients that we have performed lens exchange on that have been bothered, perhaps it could have been their floaters that they were bothered with. And now that's a new aha moment for me to learn a solution to help unhappy patients see better. So to kind of recap, communication skills, very, very important. Listen to the patient, understand things from their point of view, and take them seriously. Don't dismiss. Don't get caught up with their objective outcome and try to convince yourself that they're just crazy and we did a great job. Well, we may have done a great job, but if they're not happy, then this story is only beginning, and we need to dig deeper and kind of peel back the different layers and find out what's really bothering them, and then figure out the solution to help them move forward in this journey toward better vision such that they're going to be more satisfied. Emotional intelligence is a huge character trait to develop over your career, so you learn how to understand patients, communicate with them effectively, and work with them to help them find a solution or an outcome that they're going to be happy with. It's important to control your emotions between you and the patient, between yourself, and between you and the rest of the team. So when situations are stressful, it is super important to just detach emotionally and stay calm, breathe, take a moment to process the situation, think calmly about solutions, and then make a decision and execute. It's important that you maintain this emotional control between you and the patient. So if the patient gets upset or emotional, it's very important that as the physician, you stay calm and you stay rational and you stay objective and rationally concerned and empathetic. But under no circumstance should you rush the patient, give them a sense that you don't want to give them enough of your time, or that you're not legitimizing what they're saying. If a patient is upset, the worst thing you can do is dismiss them or rush them in any way. You've got to basically stay calm and just listen. And when it comes to the team, when things are going wrong, it's important to take ownership of everything and everyone around you. As the physician, you're the boss, and if you're stressed out, everybody around you will get stressed out, whether you realize it or not. So it's important to just stay calm, control your emotions, stay detached. Just whatever you can do, whatever mental maneuver you can use to stay calm from an exterior standpoint, such that your team knows everything is going to be okay because you've got it under control. If you've got it under control in your own brain, it's important for you to speak calmly, speak softly in a normal tone of voice, and lead your team, guide your team, and allow your team to move into position essentially and get everything together to help you solve your own situation. I think it's super important to subordinate your ego and remain humble at all times. Even if you know that you're essentially crushing it in some way, shape, or form, never think too long about it. Just always stay humble and subordinate your ego. So, for example, I'll have patients ask me all the time, why should I choose you over XYZ physician down the road? And I'm actually quite uncomfortable in answering that question. I do believe that over my lifetime, I've developed a very solid set of skills. And I do believe that what we do is at the very, very highest level. In some ways, I think that what we do is as good as what can be delivered anywhere in the world. So I'm very proud of our team and our organization and the level of care that we're able to deliver for our patients. But when somebody says, why should I choose you? I feel uncomfortable talking about myself in a way that would ever be construed as he likes to brag, or he is boasting or putting himself above others in a way to convince somebody to choose them. It's almost like, forgive me for the analogy, but if you're really great, it's not a good look for you to tell others that you're the greatest. It's really for others to say that person is great, or one of the greatest, or the greatest. But if the individual calls himself or herself the greatest, that's not a good look in my opinion, and I just want to avoid that. So I think just stay humble and subordinate your ego, but be as great as you can. I guess if somebody says, why should they choose me as their doctor? I'll say, I think we're very good. We're obsessive about perfection and getting everything as perfect as possible. Our team is very well trained. Our focus is on achieving the best outcomes with physicians that are super skilled and competent and compassionate and honest. And we build a team that reflects that. And so I'll tell them, if you walk into our practice, you will see excellence in every way. And if you don't, I want to hear about it, because I think our phone should be answered by a person. That person answering the phone should be competent and professional and thorough. And when you walk into our office should be clean and organized. You should be greeted by people who have professional customer service. And when you're taken back, our staff should be highly trained. For example, if somebody says, why should I choose you to have my lens implant surgery or lens replacement surgery? I would say, this is what we do. This is our specialty. And we're very proficient at performing the surgery, preventing problems, managing side effects if they do occur, getting you to see as well as you can. I think we're fairly perfectionistic in what we do, and you should see that at every level within our organization, from our website, to the people that you communicate with. If you call our office and speak with them, you'll speak with a knowledgeable member of our staff. When you walk into our office, it should be clean and professional, modern, and the staff should be professional, polite, competent. The process by which we assess your vision, you'll be led through a myriad of diagnostic tests using the very latest technology. These tests will be administered by our staff, who will be super knowledgeable, professional, excellent communicators, and you'll be taken care of by physicians who are skilled and technically proficient in what they do, and will devote all of our resources to helping you see your very best. And I believe that the service we offer is as good as can be found anywhere in the world. And I do mean that. And I'm a recipient of that type of work. I've had surgery on my own eye by our own physicians in our own center. And so I do believe in what we do. Another recommendation for dealing with the unhappy patient is take ownership of the problem. Own what we did right, and where we may have fallen short. But own everything. Don't cast blame on anybody else, any staff member, on the patient. Take ownership. Be accountable at every step in this process, because ultimately, as the physician, you're the executive in this interpersonal dynamic. And if you blame anybody else, I think that's a bad look. I think ultimately, as the surgeon, you're the captain of the ship, you're the admiral, you're the boss, and you should own it. And once you're accountable, I think you build credibility throughout the process. And I think if you blame others, I think that is you putting your own ego before the solution, and I don't think that's a good look at all. Let me talk a little bit about the business model. When I started out in practice, we charged a certain fee for elective surgery, and we would tell the patients, this is the fee for your first surgery. There's a chance you're going to need a touch-up or a second surgery, and we're going to charge a lesser fee for that second surgery. And we would tell them this verbally and in writing, and we'd stress it during their initial conversations with us. And we thought we were doing the patient a favor. We thought, hey, we're going to charge you a lower fee such that the surgery's more affordable for you, and we won't build in the retreatment fee. We'll just charge a fraction, almost like a copayment, for any retreatments. And what we found was that though our intent was virtuous, the result was adversarial, because we would do the surgery, and if we, let's say, had to retreat 10% of our patients, when we would have that conversation, we'd say, okay, well, Mrs. Jones, you don't see as well as you want. We can bring you into better clarity by doing a second surgery, and that second surgery will be a fee that's, let's say, a tenth of your initial fee. They would sometimes understand it, but a lot of times it would be like a bitter pill for them to swallow. From their perspective, they thought, wait a minute, doctor, you didn't get this right the first time, and so that's on you, and now you're charging me again. Well, that's just a way for you to make more money off of this whole process, and I don't like that. I'll do it because, yeah, I vaguely heard you tell me that before surgery, but I don't like it. And it kind of created this adversarial relationship. Well, we did that for a number of years, and in retrospect, I wish we'd never done that. We got smart and we realized, hey, if we retreat 10% of our patients, then why don't we just increase our fee to account for that? We'll charge everybody a slightly higher fee. So in the original scenario, let's say we would charge them $5,000 for their first surgery, and if they needed a touch-up, then we'd charge them $1,000. And we had to retreat 10% of patients. We thought we were doing the patients a favor by reducing their initial fee, but because we would offend 10% of our patients by charging them that $1,000 retreatment fee, even though that was just our costs. They didn't like it. So what we essentially did is we said, well, we'll charge all patients $5,100. And if we retreat 10% of them, then that extra $100 that we charge 100% of patients will offset the $1,000 retreatment fee. And so when we charged $5,100 and we ran into that patient who was in the 10% that needed the retreatment, we said, well, your retreatment is at no additional charge. We found patients were uniformly happy. We didn't have any more difficult conversations about costs, and they appreciated the fact that our goals were completely aligned from start to finish. There was no double dipping or sense that we're rigging the system to double charge the patient. So I would recommend, in constructing your business model, include the cost of retreatment in your initial surgical fee. So what we tell our patients is we're going to charge you a certain fee, and that'll cover all retreatments for a year after surgery. After a year, there are costs, and we spell them out. We usually don't have to go to that policy because most retreatments occur within the first year. So that's my recommendation. The business model is important. Make it almost like a buffet policy rather than an a la carte charging policy. And I think in the long run, it makes the patients happier, the staff is happier because they don't have to have these difficult conversations, and it makes your life happier. Finally, I'll just say this. In dealing with the difficult patient, just work every day to get better. Get better from a communication standpoint, a medical standpoint, a surgical standpoint, such that you develop better skills in all aspects every day, such that when complex, demanding situations or people come your way, you're ready and you're prepared. And you won't always be prepared for every circumstance, but have that as an aspirational goal. And it's never easy because I think the natural tendency is that we want to essentially coast at a certain point, and it's easy to do the same thing the same way over and over again. It's actually difficult to change and adapt, but you have to understand that the law of the jungle is if you don't change, you don't evolve, you don't grow, you don't build more skills, you don't learn how to interface with people better, that you eventually make yourself obsolete, and you kind of work your way out of a role because the future really belongs to those who want to evolve, want to get better, have a sense of emotional intelligence that they need to get better, a work ethic and a will to change, adapt, and grow. And that's who the future belongs to, in my opinion. So in dealing with the unhappy patient, these are some of the recommendations I have. And I find that if you adapt these principles, then ultimately you will have a happy patient and a happy ending at the end of the day. So that's all I have to say. Hope this was helpful. Thanks for watching, and have a wonderful day. Bye now.